I'm Tom Sticks with Empire Surgical. Thank you for taking the time to watch this video. What I'd like to discuss today is Fusion Compound Pharmacy, which is a leader in the ever-evolving field of topical pain management. I want to focus in on some of the clinical advantages that differentiate Fusion from some of the competitive products on the market, particularly Pennsaid. I'm going to do this by looking at three different parameters. One, the indication for use. What can these products be used to treat? Secondly, the efficacy. What are the active ingredients, at what percentages, and how effective or ineffective are they? Thirdly, I want to touch on the ease of use for the patient. So starting with indications. Pennsaid is labeled for and marketed towards treating osteoarthritis of the knee. That is the only indication that Pennsaid holds. This is very, very limiting for doctors when trying to treat patients that might have multiple ailments. Working with Fusion, being a customizable formulation, doctors are able to treat a myriad of different ailments. Not only osteoarthritis of the knee, but osteoarthritis of any joint. On top of that, it can be used for plantar fasciitis. It can be used for post-herpetic neuralgia, fibromyalgia, tendinitis, general neuropathy, musculoskeletal pain. The list goes on and on. So with Fusion, you're offering doctors a solution for multiple ailments that can treat many different patients. Second point I want to make, efficacy of the products. Pennsaid uses a 1.5% diclofenac base. Fusion starts at 3%. And being customizable, we're able to change that formulation to go up to, say, 5% if a doctor feels it would be necessary. This is a great advantage. On top of that, Pennsaid also uses a 45.5% DMSO. That is an extremely large number. What Fusion does is they use a 10% DMSO driver. And we found that at 10%, that is a perfect percentage to drive the medications through the dermal layer of skin down to the site of neuropathic pain at the nerve endings. When you get up to 45%, as Pennsaid does, it has a tendency to dry out the skin, cause irritation, and really causes additional problems for the patient. On top of that, Fusion is also able to offer muscle relaxers, antispasmodics, local anesthetics, and an NMDA antagonist receptor in the form of ketamine. So the synergy of combinations of drugs that are available through customization with Fusion can treat all these different ailments much more effectively. Last point I'd like to make, ease of use. Pennsaid is advised its patients to use 40 drops of a liquid form of its medication. It requires the patient to take the bottle, count out 40 individual drops, and apply that to the knee. With Fusion, the compound comes in a very easy to use vial with a pump on top. 1 pump equals 1 gram. Patients are advised to use 1 to 2 grams 3 to 4 times a day. Take that in the palm of their hand and then rub it into the affected area. It's very easy to follow, very easy to do, doesn't require any counting, and patients are very happy with it. By using a simple to use product, patient compliance goes up and then patient outcomes improve. So it's really these three reasons from a clinical standpoint that differentiate Fusion from Pennsaid. It's one, the indications. With Fusion, you have a lot more options to treat a lot more different ailments. 2, from an efficacy standpoint, more active ingredient, more options, better patient outcomes. And lastly, ease of use. If the patient can't use it, then they're not going to receive the benefits from it. That's really what it breaks down to when comparing Fusion to Pennsaid. I appreciate you watching the video. I'm Tom Sticks with Empire Surgical.